डॉक्टर निष्ठा, व्हाट इज़ दिस HMPV वायरस? क्या कोई नया चाइनीज़ वायरस है मार्केट में? क्या दोबारा कोविड-19 जैसा पैंडमिक होने वाला है? एंड व्हाट आर ऑल द प्रिकॉशंस वी कैन टेक जिससे हम इस वायरस से बच सकें? Well, there's absolutely nothing to worry about. HMPV or human metapneumovirus is not a new virus. It is an old virus which has been in circulation since a long time. But having said that, precautions are necessary. So hi guys and welcome back to my YouTube channel. My name is Dr. Nishtha Agrawal and today we'll be talking about one of the most in news topic of today's time, that is HMPV virus or human metapneumovirus. So I will try to cover everything about the virus and especially about the precautions that we have to take on our part. So please watch the video till the end. So let's start. Let's start by addressing the most curious question first, that what is so special about this virus and why it is gaining so much attention? What is the hype around it and why we are seeing such a surge in cases right now? So, the story has started because of the surge in cases that we are seeing from northern China, and following that, 3 cases have been detected in India so far, 2 from Karnataka and 1 from Gujarat. And one is being tested in Kolkata, but it has not been confirmed yet. So, anyways, then what is so special about this virus? Why is it gaining so much attention? Well, HMPV is not a new virus. It is an old virus and it has been in circulation since a long time. In fact, the first case was detected back in 2001 from Netherlands, and it is one of the most common etiology of the common cold जो हम सबको हर winter season में होता है. But what has happened is, post the COVID-19 pandemic, there has been an observer bias. We have anyways become more vigilant towards the respiratory viral illnesses. So now the testing for all these respiratory viruses have increased. So ऐसा नहीं है कि ये वायरस HMPV वायरस पहले सर्कुलेशन में नहीं था या पहले इससे बीमारी नहीं होती थी. It was there earlier also, but we were not testing for it. And now, post the pandemic, we have become more vigilant, and like I explained, this observer bias, because of that we are testing more for it. So it is being detected more now. But having said that, it is not like कि ये पहले detect नहीं हुआ था. Even ICMR ran a research from 2016 to 2019 where they tested the respiratory viral panel on 16,000 or so test patients, and उसमें भी HMPV and RSV and other respiratory viruses were detected. How is it different from COVID is because जो SARS-CoV-2 था, जो कोविड वायरस था, COVID-19, वो एक नॉवल वायरस था. नॉवल मीन्स इट वॉज अ न्यू वायरस. द ह्यूमन पॉपुलेशन डिड नॉट हैव एनी इम्यूनिटी अगेंस्ट इट. But this HMPV, it has been in circulation since a long time, so we have immunity against it. So let's learn a few more things about the virus. What is the most common age group which is affected? So it is the children, the elderly and the immunocompromised. That is the children below the age of 5 years, 0 to 14 years, but more specifically less than 5 years. Elderly above the age of 65 to 70 years, and immunocompromised. What do you mean by immunocompromised? Any chronic heart or lung condition patient, COPD, asthma, any valvular heart disease, anybody who is on long-term steroids or immunosuppressants, organ transplant patient, bone marrow transplant patient, cancer patients. So those people are more predisposed to getting the infection. How is it transmitted? So, it is a respiratory virus. So obviously, it is transmitted via respiratory droplets or via any contaminated surfaces, जहाँ पे वो respiratory droplets can rest. So, what are the symptoms? The disease ranges from mild to severe spectrum. Mild may we have the common cold symptoms like fever, cough, cold, runny nose, coryza, malaise. There could be wheezing. Whereas when we go to the severe end of the spectrum, there could be fast breathing, stridor, noisy breathing, difficulty in breathing, and this is the time when you have to go and visit a doctor. So if your child is less than 1 month or 2 months of age and it is having trouble in breathing, you can see chest retractions, पसलियाँ चलती हुई दिख रही है आपको, सांस लेने में दिक्कत हो रही है बच्चे को, तो उस टाइम पे please go and visit a doctor. Alright, what is the treatment? So, like I said, it's a viral disease, so there's no specific treatment. The treatment is only symptomatic, and there is no specific vaccination for it, unlike COVID-19. But most likely we don't even need it because, like I said, it is just a common cold virus and nothing else. But having said that, precautions are very necessary. So, what are all the precautions we can take on our part to stay away from it? Is, see, first and foremost is of course the hand hygiene. So Use soap and water to wash your hands. Use alcohol-based sanitizers. I guess post the pandemic, anyways, we all must be using it. Uh, please wash your hands after touching any contaminated surface like tables, chairs, doorknobs, car handles, bike handles, anything like that. And then you enter your house, and especially if you have children or elderly living with you, use masks while going to public places. Avoid going to crowded places as much as possible. Resort to social distancing. Let's not all forget 6 feet दूरी mask है ज़रूरी. So these are some of the respiratory illness etiquettes and precautions that we have to take. जो कुछ हमने COVID-19 के टाइम पे जो precautions लिए थे वही same precautions लेने हैं. And be vigilant. अगर कोई भी severe symptom आपको दिखता है, like I talked about in my video earlier, please go and visit your doctor. But again, reiterating the fact that it is just a common cold virus, it is not a new virus. कोई भी नया म्यूटेशन नहीं है. हमेशा जो हमको खांसी जुकाम होता है वो जिस वायरस की वजह से होता है उन्हीं में से एक वायरस है ये भी. हमें अपनी तरफ से जो प्रिकॉशंस लेने हैं वो प्रिकॉशंस लेते रहें, लेकिन पैनिक नहीं करना है. So, alright, if you have any more questions, then please feel free to ask in the comments below. I've tried my best to cover everything about the virus, and stay safe.